To health matters now, patients across the country have been persistent in their cry for faster handling of emergencies by medical workers. To curb the mental and emotional violence that emanate from such situations, the international community of the Red Cross, in collaboration with the National Association of Public Health Physicians, put together a two-day training for 40 doctors at the Lagos University Teaching Hospital LUTH. Health correspondent Jacqueline Ogo was there.
Healthcare institutions and personnel come under the highest level of pressure during emergencies, and many Nigerians rate them based on how fast they respond. To ensure there is no violence or rights abuse between both sides, the international community of the Red Cross, ICRC, in collaboration with the National Association of Public Health Physicians, decided to put together a training for 40 doctors in LUTH to checkmate doctor-patient crossfire during emergencies by aligning them with humanitarian laws.
On the healthcare workers side, we're looking at areas to make them understand that they need to actually stick to medical ethics. Empathy should be shown to these patients. They are here to see healthcare workers, and some of them are already sick, so the empathy should come in. They're already stressed.
They are also being taught how to handle emergencies arising from armed conflicts.
Armed conflicts, as stipulated by the international humanitarian law, they should actually be impartial and giving care, not based on any race or religion or how the patient looks. It's strictly based on needs.
I had to clear the air on one issue that makes patients frown at healthcare providers, which is the rejection of patients in emergency conditions.
It has been made clear now that the law allows for a health worker to provide at least emergency treatment to a patient who needs it, after which the patient can then be handed over to the right authorities for whatever they have to answer to.
And then came this advice.
Once you're ill or you're sick, you should seek access. You should go to the health facilities to seek for help, and not just stay at home and assume and treat yourself and use all these herbal things, that are not properly quantified.
If you have ever witnessed flaming anger from patients to nurses and doctors during emergencies, you will be able to align the ongoing training with ensuring sanity in the health sector, especially with the COVID-19 pandemic and emerging diseases creating more room for the outburst of negative emotions in health institutions. Jacqueline Ogo, TVC News, Lagos.